everyone, welcome to the Smile Project, a podcast from School of Dentistry, IMU. Thank you for joining us today. This podcast is all about holistic dental education on the go. This would enhance your knowledge and attitude not only towards dentistry but life as a whole. Tune in to hear and learn from specialists from various fields of dentistry, sharing their experience and discussing topics in the realm of dentistry. Also, we have in store a small dose of inspire and influence, a section for good quotes and productivity tips. So, let's begin.
Hey everyone, welcome to another episode of the Smile Project.
Joining us today is a very familiar face to all of us IMU dental students, and that's of course Professor Muneer. While his official role in the School of Dentistry is as the Associate Professor for Academic Affairs, most of us know him simply as the friendly prof who never fails to brighten our day.
He is here with us today to share his story, a long time coming, being in the industry. But before that, of course, let us welcome him to the podcast.
Hi, thank you for having me. And I'm sure this podcast we started some time ago, and it will be a very good learning experience for all of us. So we all learn together in this journey.
Absolutely, Prof. On that note, even though we see you quite frequently throughout the school and everything, but not a lot of us know your background, your history, and how you came to be in IMU and stuff. So could you perhaps give us a short introduction about yourself, perhaps sharing on how you became the person you are today?
Okay, so actually my journey is quite interesting. My father is a professor of dentistry. So based on that, definitely father always wants the son or daughter to be the dentist. So I came into dentistry. I always wanted to become a plant genetics engineer. But somehow I was even got admission in agriculture university for some time. But then I saw not the pressure, but the challenge that yes, I can. And dentistry was also fascinating for me. So I joined dentistry. Then when I graduated in 1997, I got admission in University Malaya for post-graduation in conservative dentistry. So I came to Malaysia in 1998. So I was 2 years in Malaysia. After this, I went back, I served my own country, and in 2008, I came back to Malaysia as a dental public health person. So the whole story is how did I get into dental public health? So dental public health was because I did 2 masters. Other than that, one is health planning and management, the other was public health master. So that's how I came into public health, because I thought there will be a lot of clinician but very few public health, and that is something really important. And in fact, COVID also reinforced the same thing. Public health is very important.
Absolutely.
So you have been through quite a lot from where you are from and where you are now. What were some of the challenges you faced along the way?
Okay, I have some challenges. One of the biggest challenge is my father was there as a teacher, and he's a very strict and disciplined person. So at home he was the father, and at the campus he was sir, and that was very clear to me. The biggest challenge other than that was the expectation from me, from everyone, because since childhood everybody knew me as Muneer, who was 2-year-old and 3-year-old, and the same people became my teachers. So they had a lot of expectations. Sometime I thought that it is not very realistic, because they will always compare me to my father in one way or other way, that he is like this, but he had at that time about 30 years of teaching experience. I even was not even nowhere near him, and still nowhere near him. So that was a challenge which always was there, and which I think at times pushed me a lot, give me a lot of stress. But then my father always would help me out in this, that you try your best and don't worry about these things. But then definitely expectations are there. And the challenge for me is I was just told that when I graduate, I should be better than him. That's not easy when somebody tells you this. So I think other than that, the small and big challenges came on the way, and I have never looked back, and I just learned from all these. So I definitely made mistakes, learned so many new things. But one of the biggest was the expectation from me to perform like my father was one of the challenge. I still sometime like he worked and he was, I think he totally retired from dentistry at age of 75.
Wow.
So it was quite a long journey, and definitely I can't match his experience, his wisdom, the way he worked. So yeah, people compare me with that.
So despite, I guess you acknowledge like you can't match his wisdom or his experience, for example, you mentioned, but do you still feel that expectation of you to be at a certain level, or have you kind of relieved that expectation of yourself?
Actually, I have relieved myself because I just try myself to be a better person every day than yesterday. So if expectation, the journey my father went through, like the same spot he would be here like 30 years ago, and now times have changed, the challenges have changed. He would have never experienced the pandemic. I have experienced something new. So sometime when I share things with him, he give me a perspective. His perspective is always a bit different because it's just the same thing that are you part of the problem or solution? If you decide on which part you are, then it's very easy. So he always tell me about these things. So in one way or other way, I think I just try my best to improve myself every day and learn from mistakes and try to be as much as helpful I can be. That is what I try to do, because his experience I can't match. It's almost 50 years of dental experience. Like he himself say that because he's very good in extractions when he do oral surgery. So I asked him, how do you do it? I take so long time. He said, now my fingers are so trained, when I hold a forceps, my fingers automatically, muscle memory start doing it. I don't know how it happened, but it happens. For to reach that level, it takes a lot of experience.
I see.
I'm sure for many of us, we face expectations not from other people, not only other people, but ourselves. Like, how do you manage expectations from other people, like the overwhelming expectations from other people around you and also yourself?
Okay, for that, what I try to do is I reflect. I try to reflect. I think in my class I always mention that in a day 20% of time is yours. You can do nothing, or you can reflect, or you can improve something, you can learn some new skill. So what I do is every day when I go home, I have some time, I sit in balcony, I think of the day. And definitely when you are in career growing up, people have expectation from you. Some you know, some you don't know. So it is always best that you communicate with people. So you know that, okay, they are expecting this from me, that how it should be delivered. So you can fit to their expectation. If you don't know, you don't communicate, that is the problem. Because when Mr. A or Miss A thinks something from me that, okay, Prof Muneer will deliver this, and I am not able to, that is something that create a problem. So for expectation, as I said earlier, I try my best to be better person than yesterday. That is the only thing I'm doing, because in last 2 years I have learned one thing: every day was a challenge. Every day we will come to online on campus for a meeting, something new have happened, new SOP have come. So it was my learning was in a fluid situation. We used to make concrete decision, so it's not easy. All you need is you need to be very agile and flexible with what you do. If we are very focused, know that my way is the right way, it may not work, because everybody is contributing, and we have to, like, when I make decision, I talk to many people, and then make a decision which I think is right for that moment. Because what we did, for example, in last 1 year, what we did, if we do it again in 1 year time, it will be like a blunder, a big mistake, because everything has changed. So that's the best is that expectation. Yes, you just know that people are expecting this from me or from my position. and then you try to match those. If not possible, there are some expectations which are beyond you. You just, I won't bother. If I can't change it a lot, I won't bother. I'll try my best, but will not just go into depression that, I will just tell them that, okay, my limitation are until this. After this, I'm not able to deliver this thing, and that's clear. So they can, at least they are clear that, okay, like there are 100 step, Muneer will reach to 60. After 60, they have to do something about it. If I don't tell them, that's a bad thing about me. Because then they can, then the system will stop, because we all function together. Everyone has a role.
Yeah.
I see. So you mentioned, basically, to tie all back, in order to realize what you're capable of doing and your limits, that would require you to do a lot of introspection, a lot of reflection on what
Yes.
you yourself are able to do, and also a lot of communication with the people you're working with.
Yes.
To set those expectations very clearly.
Yeah.
All right.
Yeah, and also like self-acceptance of your own limitations.
That's very important.
I'm going to take it a step back. I'm going to take it back to when you were talking about your education and how you moved to Malaysia from Pakistan, I believe.
Yes.
Okay. I'm just curious, why did you overall choose to come to Malaysia and live here permanently?
Okay, that's also a kind of interesting story. So again, I think in my whole story, my father is just like one anchor which I will revolve around. So my father is definitely clinician also, so he has a private practice. So he has few associate dentists in his clinic. So when I graduated in Malaysia, it's compulsory service. We have the house job, we call it a residency. So I used to go to my father clinic in the evenings. So when I went there, so one of the doctors there, he was holding some form which was a language I could not understand. It was Bahasa Malaysia forms. So he told me that I'm trying to get admission in University Malaya, but the forms are in Malay. I don't know how to fill. So do you know somebody? So I told him that in this building I have seen office. On this they have written Malaysia and the Malaysian flag. Just let's go there and ask them. So I went there. So that person was my father's patient. So he was so happy that we were in his office. Then I told him, do you know how to translate Malay into English? Oh, he said, I have 20 years experience there. He worked here, so he knew. So in that, we took a Xerox, a photocopy, and every line he put it in English for us with pencil. We came back, and when my friend was filling the form, he said, oh, you are sitting doing nothing, just fill the form also. So I said, okay, I'll fill the form. Then we filled the form. We submitted the form, and honestly, we forgot about it. Then one day, after a few months, then he said, we have not received anything. So that time was fax, not email. So we faxed here, and then they said that in 10 days you will receive a letter. So that's how, I was trying to help somebody, and helping somebody helped me arrive here. So, in fact, when I came to UM, that time they started that master's program. So I was the first postgraduate to register. I still remember my number. It was 98001, 1998 0001. So I still remember that. Even a few days back in UM, they asked me, and I remembered my number because it's so easy, and I was the first person. So from there, 2 years I was here. That time our former dean, Prof Dr Muneers, she was the head of department. And the current dean was a lecturer. So I know them from all that time. So 2 years I did my master's, then went back. But I really liked the way the progressive work in dentistry, the research and all these things. I was quite impressed. And I always wanted to come back. Then when I went back, I got married. My wife is an educationist, special need education, so she was running school which was for inclusive, a new idea again. So because of that, and then in 2007 there were some security reasons in our region, So one of my friend who was from previously, he was visiting me. So he said, you just send your CV and you try your luck. So I sent my CV here, and then I got a job, and then in 2008 I arrived here. So,
You mentioned your job is here in IMU, is it?
yeah,
I see. So this is basically where you've been since 2008.
yeah.
I see.
So 8th June 2008 I joined IMU.
Wow. You even remember the date.
Oh, it has been such a long journey.
Yes,
for you.
14 years almost.
Wow. Like, I'm sure it has been, quite a cultural experience too, moving from Pakistan to Malaysia.
Definitely.
How was it like adapting to the culture here?
Okay, I think not many things were difficult for me. The only thing that I found, because I'm a Pathan by race, so we are more like, meat eaters and all these things. And when I joined here in in fact, that time was the culture of the rice was like everywhere. For me, I never liked rice.
In Malaysia.
No, in Pakistan.
Okay.
And my mother will never cook until it's like 2 weeks once in 2 weeks, and then she will ask me, okay, I'm making rice, what do you want? So she will, because somehow I never was so towards rice. And then when I came here, that was the biggest cultural thing for me, and everywhere was rice. And then I called my mother what to do. She said, now it's up to you. So then in there are so many canteens, which wherever canteen I'll go, they say no roti chana. In fact, that time I even did not know roti chana and these things. So I had started eating rice, but I did not like it. So first 2 months I've lost 30 pounds just because I was not eating. Then my friend who are doctor in they told me that no, it won't work that way. You have to come out of your comfort zone. That was my first lesson. And from that was one thing. Language was normally not an issue for me, because in most of the people were there talking English, so that was not a big problem. But related to food, that was one of the biggest thing for me. And then I started I moved toward rice, and now like it's almost daily. At least lunch is rice. You can't escape it. So that is and other, I don't think so, because as a Muslim I have no issues here. Sorao is everywhere and all these. So I think that was very comfortable. And Malaysia is honestly like it's rightly called second home, because you get food. Now I know that time I did not know whatever food you want, every type is here. Wherever you go, you are accepted. It's quite a nice way of like you don't have these issue until unless I create an issue with somebody. There is nobody is creating an issue with me, and it's just like a smooth sail. That's why a lot of people want to come here.
So overall, it wasn't really the culture or especially the language. It was overall the food for you.
Yeah.
But ultimately, you managed to adopt the Malaysian ways.
Yeah, because you have to always. There is a time you have to go out of your comfort zone. So naan and roti was my comfort zone. So ultimately, have to move out. Other than that, I don't think so, because whatever you think, you can go holidaying, all these things, and it's quite easy.
Do you have a favorite Malaysian dish that you feel?
My favorite was nasi pattaya for some time.
Okay, nasi pattaya is like the fried rice, then they put an egg over it with the
yes.
tomato sauce. I see.
Exactly.
Okay.
So it because when I used to live in section 16 PJ, so there was a small canteen. So that lady used to make amazing. So just imagine when I start eating rice, it was because of that. And straight 2 months, I think lunch and dinner both same thing. So she told me that we also make other things also.
Nasi pattaya for 2 months straight.
Yeah.
Wow, that's amazing. Okay, moving on now, I guess, from the cultural aspect of things. But you mentioned previously on how Malaysia's the approach to dentistry is more research-oriented, and they're quite, I won't say experiential, but they're willing to try new things.
Yes.
So aside from that, or maybe you want to elaborate more, how is the practice of dentistry different in Malaysia compared to Pakistan?
Okay, I'll just start from the academic. Our academic are more too much clinically oriented, because the sheer volume of patient is so much that it's very difficult. You have to be very focused for research, otherwise it's not possible. Like I saw my professors, they tried, but it did not work. Like the hospital from where I got my training, the daily number of patient was between 1000 to 1400 daily.
Sorry, this is in Pakistan.
Wow.
So like 1000 to 1400 daily patient. These are OPD, everyday patient. So then you have some appointment patient, even the orthodontic department have almost, I'm talking about 93, 94, and at that time, they have 2 years of waiting period. So the number, because that time the specialists were very few, and the number of patient, plus that time the Afghan conflict started, those days, not started but sometime, so the refugees are coming to main hospital for treatment. So that's how the culture changed from research to very clinically oriented, because they don't have time. Like whole day, if you are on a campus, you are treating patient, then your focus is there. So one of the main thing which was that we were very, very clinically oriented. Most of the time it's clinics. And then so when they moved from one generation to another generation, they saw it that they have to be very good clinician, because they saw their teachers like role models, that they were very good clinician. So that's how the research component becomes shrinking, and they have literally no time. Now the culture has revised, and that is one thing which I think was quite big. When I came to Malaysia, they have definitely the patient volume in that time was not very high, and the number of personnel, they have so many staff and faculty, so they never had that issue. So they every faculty have their research time, clinical time. But in my place in Pakistan, that time was not possible, because it was not possible to even finish the number of cases per day.
I see.
So, this reflects the cultural difference in a workplace setting in Pakistan and Malaysia. But what sort of advice would you give to us, especially those who want to go to PDS? What would you advise us, those who want to study or work overseas in the future?
Okay, I think for one most important thing, wherever you go, you have to have an open mind. We all have our cultural baggage with us. I know when your first or two or first few batches, your senior used to go, they used to miss, like I used to miss my food and things like this. They will contact me on Facebook that they miss something. And even I know a student, they contacted me that because of this cultural reason, they even wanted to come back. But then that's not the solution. The solution is we always have to adopt. We have to be agile. We need to know which is our comfort zone. So my advice always was that be open. When you go there, life is not a straight line. It is ups and downs in life. That will happen. If somebody think my life will be a straight line, it's next to impossible. Nobody has a straight line. It has to go up and down, and then you have to, in good days, you have to do different things. In bad days, you have to carry yourself. As long as you don't stop, you are focused that you need that degree, you will get it. If you lose your focus, then it's a very big problem, because then you start thinking about things which are more related to your comfort zone, and then you can't make a decision. The other very important thing is the BDS time is 5 or 5.5 years. So marks is there. You are all very talented. There is no doubt about it. All hardworking. The only thing is make sure you make memories of this 5 year, because this time is not going to come back, or there is no some. You need to have a mentor who can guide you. In current practices in life, wherever you are, you need to have a mentor who can guide you, because there may be blind spots for you. you don't see. That mentor with life experience can tell you these things. So and then make a mark wherever you are. Get involved in the local community. So that's how you get accepted there very quickly, because in even in a friend circle, if somebody is new, so it takes a very long time to get used to that friend, their mood swings, or all these things. But if that person comes and, like, we are all sitting here now and we need some help, and that person is proactive, is helping you, so you will accept that person very fast. So that's how you need to have memories, you need to have a mentor, and you need to make your mark.
You talked about having a mentor. So, is there a particular someone who really inspired you and kept you going when things get tough?
I believe a recurrent person in your story so far has definitely been your father.
Yes,
Yeah.
my father definitely, but he's just like more than a mentor for me, because he has a conflict of interest also in one way, because he definitely at times he won't see things. So my mentor, you can was one of my surgery professor who later became the dean, and he just recently retired. He was a person who was very tenacious. Whatever happened, he was focused. I learned from him that when you join dentistry, in next 5 years, where you want to see yourself, what big difference, like there are so many dentists, why you? That question always keep like coming back to me, that there are so many faculty members, so why me? So I have to have some impact somewhere. So that's why you need a mentor who can see the overall picture, because when you are making decision. So I'll just give you an example. In your career, for example, you are on step 3 and your mentor is already on step 30. What your mentor see is a bit further than you. The mentor can see the bigger picture. In the place you are standing, you can see it's like your field of vision is that time, because you don't have experience, knowledge is very narrow. So and sometimes the stress of learning and all these things can hamper your decision making. But that person, your mentor, can help you that, okay, I can see that in next year you have something better coming, or you can do something different. So that's why mentors are nowadays very important. Mentors and your network, your friends, because like your net worth is your network. Who do you know? And the right people, when even you are not in the room, they will protect your interest.
Right.
That's quite important, for your career also.
So overall, having a mentor who can provide a different perspective from where they're standing is also very important, and also networking with
Yes.
friends.
Definitely.
I see.
Your mentor must have imparted a lot of important values and lessons to you. So, in order to continue his legacy, is there anything that you think you have learned from him and you want to impart it to like the future generations? Like, what is the most important value that you need to succeed in dentistry?
Okay, one of the important thing, I think anywhere in the life, there are so many things, like if we talk about values, I've learned so many things, but I find one of the most important thing is integrity and honesty. These are the things like when people know that, for example, they have given you some task, you will honestly do it, you will deliver. You have integrity that you will keep do your best. So these are the things that like for career wise, there are so many other, but for career wise, honesty and integrity, if you have, you will always be in good books. And the other thing which I've learned in IMU from our former president Tansri. So that if I trust you, I'll give you work. So I always remember this. They say that if your work is not good, So this means the trust is not there. So you will not get work. If you don't get work, this means your careers have stopped. Because we all grow when we work, we learn new things, and by the way, with this, one of the important other lesson was mistakes. I have made a lot of mistakes and learned from it, and that's how I think honesty and integrity works in it. That you have done something, you just say that yes, it has happened, and I can fix it. If you can't fix it, you just let them know that something can be done. And these are few things like Tansri Abu Bakr. I've learned from him empathy. I have because as a student, the stress you have, I need to understand what are these things rather than I just keep on thinking like, okay, I am the faculty and I don't understand. I need to understand, for example, preparing for a patient. When I prepare, it may be because I have experience, I will do it differently. But when you prepare, you have different kinds of stresses.
Yeah.
So that's things like honesty, integrity, empathy. These are the things that will keep on helping you to make progress and make friends, network. And for the doctor, I think trust and empathy are very, very important. That your patient needs to trust you. That's why I always say that even if your patient is your cousin, even your sibling, your best friend, you treat them very professionally. Don't joke with them, oh, your tooth or your smile look like this or this. You just, when they are on the dental chair, they are the patient and you are the dentist. Always remember this. So they will trust you more, and that is something very valuable.
In some sense, would you say that these values, you mentioned integrity, owning up to mistakes, honesty, are these values more important than simply being a good clinician? That you have good hand skills, you can diagnose a patient very quickly?
Definitely, because you can be an extraordinarily good clinician, but if there is issues with integrity, honesty, even trust, the patient will not come to you. You need, because we are a dentist because of the patient. I'm a faculty, I'm a teacher because of the student. So exactly the same. If you are extremely good and you are one of the best clinician, like I'm talking about the skills part, but then I don't know how to communicate with my patient and these things. So the patient is not going to come. So it is of no use if I become the world best with my skill and I don't have because I need to apply. Dentistry is something you have learned and then you apply there in the clinic. If you are not able to apply, then what's the point of doing it?
Right. So you talk about making mistakes, being an integral part of improving yourself.
Yes.
And sometimes when we make mistakes, people might lose a little bit of trust in us. How do we regain that trust?
Okay, for that, if a patient and dentist relationship, I can say that when you plan a treatment plan, you can tell them which normally problem happens. Like for example, there's a deep caries management, and you don't tell the patient. And ultimately, what happens? You start drilling, and you straight go into the pulp, and the patient then that restoration become a root canal, and the patient gets upset. That's the trust issue. So if you explain the patient that okay, in case your tooth condition is like this, and this may happen, I will try my best, but this may happen, and you have option. You can take second opinion also. So that's how they know that you know your limitation. They are not like whatever you do can land them into. And what patient need is there is no pain and you can solve their problem rather than increase their problem. So that's why this is one of the areas. And in normal life, if somebody gives me task, I will just first evaluate it. What are the things? What are the things I can do? What I can't do? Where I need help? So these three things are clear. So you just tell them that my limitation is this. I need help in this, and this part we can delegate it to somebody, we can give it to somebody, or they can ask somebody else.
Right. So, to be, to go a long way, and we sometimes stumble and fall and all that. So what would you want us to bear in mind as we work towards our dreams as a dentist?
Okay, one is I always consider that we need to have an end game, that how this thing, like every 5 years, the books you read, the places you go, the people you meet, they all change. So you need to know that in 5 years, like now you are in BDS, so in this much amount of time, years, you will graduate. So what are your plans then? So some of these plans, I almost always tell my students that you write it down. These are your roadmap of your career. Like for example, in 5 years, you have graduated. Next, where you want to go? You want to do specialization, or you want to, few years, you want to be in private practice, and then, or you want to be in government service, and then you move somewhere because you want to hone your skills and or improve your confidence. So different targets, because you are the only person you honestly know yourself. Nobody knows. Even your parents don't know. You know your inner strengths and weaknesses. Weak areas are our blind spot, and normally we miss them because we are very afraid that nothing will go wrong with us. As I said earlier, life is not a straight line, things will go wrong. So we need to work on these things. If there is one area which scares you the most, you work on that. Otherwise, one day you will be in a situation that you will not be able to help yourself then. So it's better that if you are weak in something, you work on that. And it is okay, as long as you are making some progress, it is okay. But it should be some progress, rather than you totally put it in a blind spot and think, no, it will not happen. It's just exactly the same thing that people think that, oh, I'm such a pious and nice person and disaster will never happen with me. You may be an excellent driver, but somebody will come and bang your car. Then what will you do? That's the problem. That we have to be, in one way or other way, we have to be prepared that I may be or you may be good, but somebody else can do things and the chain of event will reach you. So that's how like your preparedness is very important, and acceptance that yes, this thing has happened, now let's move on. If we just think of that moment and we get stuck with that moment, we will be like literally anchored to that issue. We need to move. It's just like failure and is part of the process. It's not separate than it, that it should stop us.
So having a roadmap, willing to work on our blind spots, preparedness, and willing to move on from your mistakes.
Yes.
Thank you very much, Prof.
Most welcome.
Thank you for joining us today. And I guess throughout this whole interview, you've really just shared with us your tale of how you became who you are today. And with your advice that you've scattered throughout this whole interview, this is all something all of us aspiring dental students can definitely utilize to hopefully achieve our dreams in the future.
Yes, I agree with you, Aiden. It was a very inspiring time talking to you. And to our listeners out there, thank you so much for tuning in to this week's episode. We hope Dr. Muneer's story has inspired you as much as it has inspired both Aiden and I. Do not forget to follow us on Spotify, Instagram, and Facebook too, to stay updated with our bi-weekly episodes.
See you in the next episode.
Bye.
Thanks for listening to today's episode of the Smile Project. We hope you enjoyed. If you would like to help support the podcast, please share it with your family and friends and leave a rating or review. Thank you once again. I'll see you next time.